To talk about other uses for artificial intelligence in healthcare is Frank Lau. He's the Senior Director of Emerging Technologies at UW Health in Madison. Dr. Lau, thank you so much for your time this afternoon. We know UW Health is one of just 4 systems in the country piloting this new AI program. So kind of explain to us what it is and how it works.
Yes, thank you. I'm happy to be here. So as you mentioned, we're one of the 4 systems that are piloting this. The reason why we started to do this was since the start of the COVID pandemic, the number of incoming electronic messages to our providers has increased by 57%. And we saw an opportunity here to use generative AI to help reduce some of that workload and some of that high volume of messages. So in terms of the pilot, what we do is that the tool, which uses generative AI, actually reads the incoming message, and then it writes a starting draft for the provider. And the provider can then take that starting draft and decide to discard it or then start to edit that message. And by doing that, we're helping providers get some time savings back in the day. And it also helps them overcome some of that blank screen syndrome. If you ever stared at a blank screen and figured out, oh, how do I get started? And so that draft helps our providers get started on that and really helps them have a little bit more mental focus throughout the day.
And what role do you think AI can play in the process between patients and providers?
I think AI, for sure, right now can really help with a lot of the workload with the providers. And so we see this as being able to provide a lot of time savings and, again, more mental energy for our providers, which will in turn lead to better patient care. And then as we go forward, I think there are potential use cases where AI can help providers in their decision making to provide better treatment options. But we see that as a use case that's further down the road. But we see a lot of potential in helping providers provide better care by giving them that time savings and that higher mental focus.
We've seen a lot of attention on AI in recent months, past 6 months or so. With this technology, some may be concerned about it. Do you think it's too much too soon? Do we know enough about it yet to have it, in the healthcare system?
It's an excellent question. And so how much do we know about AI is a key question that's always in front of us. And we have to think about both the risks and the benefits. And so one of the reasons why we wanted to take on this pilot is so that we can understand more, have a better understanding about how AI could be used safely and effectively in healthcare delivery. But above all, our guiding principle is definitely to do no harm with patient safety, as well as the well-being of our providers at the highest priority.
All right, Frank Lau, thank you so much for your insight and your information. The Director of Emerging Technologies at UW Health in Madison. Thank you so much.